Because I was just swapping emails today with Andy von Eschenbach, who was the head of the National Cancer Institute, the head of the Food and Drug Administration. But before that, he was the provost at MD Anderson, the largest cancer treatment center in the world. And he wrote me to point out that the most recent U.S. government intervention on whether or not to have prostate testing is basically going to kill people. So if you ask me, do I want some Washington bureaucrat to create a class action decision which affects every American's last 2 years of life? Not ever. I think it is a disaster. I think, candidly, Governor Palin got attacked unfairly for describing what would, in effect, be death panels.
And just like Newt Gingrich said, the way that Obamacare runs, there's a board called IPAB. It's made up of 15 political appointees. These 15 political appointees will make all the major health care decisions for over 300 million Americans. I don't want 15 political appointees to make a health care decision for a beautiful, fragile 85-year-old woman who should be making her own decision.
We need to repeal Obamacare. That's the first thing we need. You want to create jobs? I went to Ossipee yesterday, and I talked to a small businessman there, and he said, I will not hire anybody. I will not make a move until I find out what's going to happen with this health care bill and how it's going to crush me.
We all agree about repeal and replace. And I'm proud of the fact that I put together a plan that says what I'm going to replace it with. And I think it's incumbent on everybody around this table to put together a plan that says this is what I'll replace it with, because the American people are not satisfied with the status quo. They want us to solve the problem of health care, to get it to work like a market, and that's what has to happen.
All right. Governor Huntsman, then we go.
It's disingenuous to just say that you can wave it all away. The mandate will be in place. The IRS is already planning on 19,500 new employees to administer that mandate. That will stay, and that's the ruinous part of Obamacare. And that, Mitt, your plan is not going to do anything about it.
I said we're going to repeal it. What, did you miss that?
No, it doesn't repeal the mandate.
No, I said I'm going to repeal it.
Wait, hold on.
Through reconciliation, you can repeal the taxes, you can repeal the spending, and therefore the mandate has no teeth because there's no tax penalty if you don't enforce it.
Governor Romney, your chief economic advisor, Glenn Hubbard, who you know well, he said that Romneycare was Obamacare. And Romneycare has driven the cost of small business insurance premiums up by 14% over the national average in Massachusetts. So my question for you would be, how would you respond to his criticism of your signature legislative achievement?
You know, the great thing about running for president is that you get the chance also to talk about your experience as a governor. And I'm proud of the fact that we took on a major problem in my state. And the problem was that we had a lot of kids without insurance, a lot of adults without insurance, but it added up to about 8% of our population. And we said, you know what, we want to find a way to get those folks insured, but we don't want to change anything for the 92% of the people that already have insurance. And so our plan dealt with those 8%, not the 92. One of the problems with Obamacare is he doesn't just deal with the people without insurance. He takes over health care for everyone. Then he does something else that Chris Christie said today. He said the problem with Obamacare is he spends an extra $1 trillion and raises taxes. And raising taxes is one of the big problems, something we didn't do in Massachusetts. He also cuts Medicare. But people out there talking about cutting Medicare, it's President Obama that did that. And I'm proud of what we were able to accomplish. I'll tell you this, though. We have the lowest number of kids as a percentage uninsured of any state in America. You have the highest. I'm still speaking. We have less than 1% of our kids that are uninsured. You have 1 million kids uninsured in Texas. 1 million kids. Under President Bush, the percentage uninsured went down. Under your leadership, it's gone up.
In the state of Texas, from the standpoint of what we've done to make access of health care better. We passed the most sweeping tort reform in the nation in 2003. We also passed Healthy Texas, which expands the private sector insurance, and we've driven down the cost of insurance by 30%. So those are some of the ways that the states, but the real issue for us is Medicaid and how to get the flexibility on Medicaid so that the innovators can occur in the states. I can promise you, whether it's Governor Jindal or myself or Susana Martinez over in New Mexico, that's where you'll find the real innovation in healthcare. The way to deliver healthcare more efficiently, more effectively, is to block grant those dollars back to the state and keep this federal government that has this one-size-fits-all mentality from driving the thought process that we've seen that's destroyed health care in this country today.
But Governor Perry, as the Washington Post fact checker noted, Texas has had 16 waivers for Medicaid. So how can you say that the problem is that the federal government has not given Texas enough flexibility?
They haven't anywhere near given the states. I think what you should see is the block granting, not having to go to Washington, D.C. and ask them, Mother, may I, every time you come up with a concept or an idea. Block granting back to the states, I'll guarantee you the governors and their innovators in their states will come up with ways to better deliver health care more efficiently, more effectively, more cost efficiently.